Okay, pregnancy update week 16. I actually have a lot of new news. I turned 36, so that was fun. Had a really good, relaxing birthday, but I've had a lot on my mind because I'm over 35. We did do genetic testing first, like a screening that tested for genetic abnormalities. It just takes the cells, like fragments from my blood, and stacks them up to see if they have like too much or too little compared to what's normal. And ours did show a higher chance of Turner syndrome, which means it would be a girl. That's exciting, but it could be missing an X chromosome. So Turner syndrome can be quite dramatic. Most Turner babies don't make it full term. They usually pass in the first trimester or second or third. Like 99% of them or something pass. It's a really high percentage. So the fact that I've made it to 16 weeks could indicate that the screening test was falsely positive. It said we had a 1 in 7 chance of Turner syndrome, so we opted to get an amniocentesis, which is a needle inserted into the uterus to collect some amniotic fluid, which would be a more diagnostic testing because it's actually baby cells. I did undergo that procedure yesterday, so because I just want to know, I can plan better, knowing what we're dealing with. If she does have Turner's, it would change a lot of my decisions. So I've been really stressed about that. 1 in 7, which means 6 out of 7 chance she doesn't have Turner's, but it's just that 1 in 7 keeps me up at night. The amniocentesis was okay. I had a really amazing doctor do the procedure. I had to get a Rogram shot because I'm Rh negative and my husband Luke is Rh positive, so that hurt really bad. Felt like a bee sting in my butt. But I get the results on Monday. Today's Friday. I have to kind of take it easy today, just because I had the amniocentesis yesterday, so I took today off and I'm just going to kind of take it easy. Been watching lots of YouTube videos. I've been kind of getting my nursery ready. I'm kind of setting up 2 nurseries. I don't really know how that's going to work. I'm setting one up in my bedroom with like a mini crib and, kind of just the bare necessities. And then I'm setting up a real nursery downstairs with an actual full-size crib and a dresser and a big closet. So I guess she'll stay up here for, 6 months to a year or however long we can sleep with her up here, and then I'll move her nursery into the basement. Our house is set up kind of strange. I'll have to give you a tour sometime. We have a really nice master bedroom with master closet and bathroom up on the main level, but it's the only bedroom on the main level. And then in the basement we have 3 additional bedrooms. So kind of our only option is to either do a nursery in our master and a nursery downstairs. So I'm not sure how long we'll stay at this house. I love this house, but it's not really equipped to have a baby in a separate floor of the house. But in today's technology with cameras and such, maybe it'll be just fine. So amniocentesis results back in 3 days. I just really hope everything's fine, of course. But if it's not, I don't know what I'm going to do. So that's week 16, and I'll try to do an update maybe week 20. I'm feeling a lot better. I still have some slight meat aversions, especially cooking raw meat. The smell just nauseates me, so if my husband's cooking meat, I usually ask that he does it outside on the grill. But I've been able to eat meat. That's a huge step, because for the first 3 months I could not eat any meat. I could barely tolerate fake, vegetarian meat. So I feel like I'm doing a lot better now. Still pretty tired, still having insomnia. I talked to my OB yesterday and she was suggesting that I start taking some Unisom because my insomnia has gotten so bad. I wake up at like 2 in the morning every morning and just can't sleep. But I take some pretty good naps during the day, so kind of makes up for it. But I'm so excited for everything to be negative, and to finally tell everybody that we're having a girl. Because right now I'm like, yeah, we're having a girl, but it's really frustrating. I haven't told a lot of people that we're having a girl yet. So, thanks for watching. Pregnancy update week 20. Turner's was negative. Yay! I'm so excited about that. I was so stressed. I kind of forgot how stressed I was because once it came negative, I just like washed it all behind me. It's over. It's a false positive. I did read online that older women have a higher incidence of false positives because as you age, your X chromosomes become inactive or something, so it can show up as like a low number of X's in my blood, but then when they took the amnio fluid, it had the appropriate number of X's. So I talked to my maternal fetal medicine doc today, and he was like, I've never heard that, but maybe. And so I don't really know why we got a false positive, but I have read a lot of stories of people getting false positives on the initial like blood screening. It's just a screening. It's not an official diagnosis. So the amnio was the official diagnosis, and that came back negative. It did come back with some slight higher risk on chromosome 6 of like early onset diabetes and hypothyroidism, which are two diseases my family deals with. So they're doing some additional tests for that. I don't even care. Whatever. They can test away. I was looking what my insurance paid for all those tests, and these additional tests that they're currently working on, they said they would just tack on to the fee, but the fee for all the initial tests was $25,000, and my insurance paid for that. I couldn't even, it like approved it. I couldn't even believe it. So I don't know if you didn't have insurance, or if your insurance required that you pay a certain amount of that, that could get really expensive. So I don't know if that initial screening test is really worth it, because it was just stressful. It made my life an absolute hell for 4 weeks. I couldn't sleep. I still can't sleep, but for better reasons now. We decided to name the baby Alice, so I'll just refer to her as Alice from now on. But at 2 a.m. every morning, she wakes up and starts just kicking away. I don't know what it is with 2 a.m. It's like she has an alarm clock set, and I can just feel her kicking. So it wakes me up, and then I like just lay there and want to feel more, so I can't fall back asleep. So it's pretty cool. The kicks are amazing. It's like almost like period cramps, but they're not painful. They're just like little tension, little like somebody's grabbing your uterus or sides of your abdominal wall, just like giving them a little squeeze, like a little hug. It's pretty cool. And I can feel them on the outside of the wall now too. I'm like 20 weeks and 2 days or something, so I've been feeling the kicks for maybe almost a week. Like I didn't quite know what they were at first, and I was like, was that a kick or was that gas? I don't know. And now that I look back on it, they were definitely kicks. I just wasn't like in tune to what they were. But now you can feel them through the outside, which is really cool. My husband's felt a couple of them, which is really exciting. What else? No more meat aversions. I can eat like any meat. Doesn't bother me. Except for tomatoes for some reason. I've got an aversion to tomatoes, which I used to love tomatoes. I would just pop cherry tomatoes like candy. So I'm not really sure why I'm having a tomato aversion. Maybe it's like an avoidance of heartburn or something. But everything else, I've done pretty well food-wise. I actually have really been craving healthy food, which I'm very happy about. You know, lots of fruits and vegetables. Like I could eat a whole fruit tray. And then steamed veggies. I'm just craving all kinds of steamed veggies. Or blended up and then boiled veggies. Just so good. Oh, what else? We had our 20-week ultrasound today, which was amazing. All of her organs measured fine. She was like 12 ounces. I can't remember how long she was, but totally in the normal range. They said like the 53rd percentile, so just totally normal. Doc wants to do a fetal echo because Luke's, my husband, his sister, passed away from a heart congenital heart disorder. So, but based on the ultrasound today, they said the heart looked great. So they don't have any concerns. They just want to be, cautious in that. Planned my baby shower for, I think I'll be like 27 weeks for my baby shower, or 26 weeks. And then we're doing a baby moon out to Victoria, Canada. So that'll be exciting. Never been to Victoria, but I love Canada. And Victoria looks like an English colony in Canada. I'm pretty excited about that vacation. We're staying in a really fancy hotel that has free bikes, so Luke can go ride bikes around the city and I can go get a massage or something. He thinks I can ride bikes, but I think he's going to be surprised at 27 weeks when I'm not capable of riding a bike. He's a little clueless in that. Whatever. I put away a lot of my clothes, especially my smalls. Kept a couple of my mediums out, but I've folded and put away a lot of my small sweaters and small shirts and jeans and things that I just can't fit into anymore. I finally put them in a box and put them at the very top of my closet, and went to the thrift store and got a bunch of really good maternity clothes. This shirt's actually one of them. I really like this shirt. It's got like stretchy sides on it, so it'll be really nice. And all the shirts at the thrift store are like $5 each, and they're all from like Motherhood Maternity. If you buy them at Motherhood Maternity, they're like, $15 to $20 each. But if you buy them at the thrift store, they're super cheap. So I'm really excited that I kind of figured that out early in my pregnancy, because I don't want to have to buy all these clothes and then just take them all back. Our nursery is almost totally done. We even did little letters, spelled out her name, stuck them to the wall. So Alice is gonna stick, I hope. I really love the name Alice. I feel like it's just perfect. It reminds me of so many things in my childhood: imagination and wonder and creativity, and not being so confined by the reality here and now, I think is really important. So I'm just really excited for the name Alice. And it's English. She's probably like 100% English. So I can't really think of any other updates. The nursery in our bedroom is not complete at all. I got a nursing chair and a changing table, but I don't have a crib. I'm still trying to decide if I'm going to do a pack and play or a mini crib. I'm leaning more toward the mini crib, just because she'll probably stay up in our room for the first 6 months. So a pack and play might be unrealistic, later when she's a big fat baby. And I got a couple welcome boxes, one from Amazon, one from Baby List. I'm gonna go get a Target one soon. So that's really fun, getting like little baby bottles and onesies and swaddles and that, kind of small stuff that you get for free. Just putting those away in her nursery. Her nursery is so empty, but it's got lots of like storage space that's really empty. So Luke's getting so excited. I actually started doing some research on hypnobirthing, like hypnotizing yourself to like imagine that contractions are not painful, but rather just pressure and overwhelming surges of energy. And so I probably will not be able to make it. I'm just going to be realistic, but I would like to attempt an epidural-free labor, because I just think I'm a really tough bitch, but I will probably be surprised how weak I am. I'll probably get to 4 centimeters dilated and be like, I'm done. But I've been reading a book by, I don't even remember. It's like one of the famous hypnotherapy books on hypnotizing your mind to overcome and be positive and breathe and just make it through, rather than numbing all those pain sensations. So I'm kind of pursuing that avenue. I'm kind of anti-hippie. I don't really like a lot of hippie propaganda, but in this case, I'm really loving it. I'm a nurse myself, as I told you in past videos, and there's a lot of medical interventions that are unnecessary because people are scared, and I don't want to do something unnecessary because I'm scared. I want this to be really thoughtful. So I'll let you know how that journey goes, and I'll do a 24-week update. Thanks for watching. Well, not much has changed since my 20-week update. I did get my fetal echo, which is like a heart ultrasound of the baby. I got that yesterday, and everything looked perfect. They did take some photos of her face, which were so darling. My husband thinks she looks like me, but I totally see him. You can like see her mouth is like his has like, you know, upward facing corners, like little turn up on the corner. And I don't know, I see like little characteristics, like maybe my family's forehead and nose, but his family's eyes and smile. But I'm really excited to meet her. Seeing those photos just gets me so excited. And we are heading to Utah in next week. Today's Friday. We're heading there Thursday of next week for our baby shower. My family's throwing a big baby shower. There's supposed to be like 40 people there or something crazy. All my aunts and uncles and friends, and we're doing like a co-ed baby shower. We're gonna do like some painting of onesies and some like sperm cornhole. And, you know, the guys are going to have beers and stuff. I guess girls can have beers too, but not me, which is lame. My family's Mormon, so probably not many people will be drinking, but my brother-in-law, my husband, a couple of his friends. Just not sure how opening gifts will go. Like, if me and Luke will take turns opening gifts, or if, you know, him and his buddies will be off doing something else, because opening gifts is like a girly adventure. I don't really know. His dad's not coming because he's a big old douche and says that it's a girl party, so whatever. He can stay home like a big old baby. But I'm really excited to do a co-ed baby shower. I've never been to a co-ed baby shower because my family's Mormon. It's not really something Mormons do. So I'm kind of excited to see how that goes. Like, bridal showers and baby showers, sometimes women, you know, let loose and talk about sex and the grossness of labor and delivery, and men are kind of excluded from that part of our culture, and it's not something I'm fond of, to exclude Luke from all of that, because in the labor and delivery and the first year, you know, dealing with all the nuances of having a newborn, I want him to be prepared for that. I don't want him to come in and just be like aghast, you know, because I work in a hospital. I see a lot of blood and poop and bodily fluids, but I want Luke to know what he's getting into. Sorry, my camera froze. I'm not sure why. My computer's been acting really weird lately. It's starting to make me angry. So, yeah, baby shower next week, and then shortly after the baby shower, we are heading to Canada for our baby moon. We're staying in Victoria, which is a beautiful little, like European town. Lots of cobblestone streets and castles, and it's just going to be amazing. We're staying in a really nice hotel there, so it won't be too stressful. Just nice and relaxing. And what else? Those are kind of the two big adventures coming up soon. I'm like brain fried today. I don't know why. I'm not sleeping well. I've been having indigestion. I'm only 24 weeks, and I know it's going to get harder, but I just feel like I can't catch my breath or sleep enough. So I might go take a nap right now because I'm just not feeling like making this video. Just tired and brain dead. And not much has changed since my 20 week, other than seeing cute Alice's face yesterday, which was so awesome. She's so cute. I'll try to insert some photos of her. And I'm really trying to decide if I should do the 3D photos, because my sister-in-law sent me a photo of her baby at the 3D. I think it was like 30 weeks or something. Oh, she was so cute. So much more better quality than the ultrasounds that we get just at the normal doctor's office visits. So I don't know. I probably would do that because I really want to see her more. Um, got a mini crib in my bedroom, which I love. It reminds me of like the little cribs I had when I was a little girl. It's just a little tiny crib, which could totally hold a baby. It's not teeny, but it's a lot smaller than our big crib in the nursery. And just been organizing stuff, getting everything ready. We still got 3 or 4 months. I'm just terrified that some of the nausea and symptoms of first trimester are going to come back in my third trimester, so I'm trying to get as much done as I can while I still have energy. Because I've heard some people struggle through their third trimester, and I really struggled through my first trimester. So while I have the strength, I'm trying to get everything done so that I can just enjoy her when she gets here. Guess I will talk to you at my 28-week update. Thanks.